Great, thank you, Michael, and good morning, everyone. While we still face very challenging trends in the virus's spread in many parts of the country, thanks to the Operation Warp Speed rollout of vaccines, as General Perna has been saying, we're now on offense against the virus. The vaccines we are distributing are going to save lives. This week, we have allocated more doses of the Pfizer vaccine, approximately 2 million more doses, for states and other jurisdictions to order. On top of that, we've allocated 5.9 million doses of the Moderna vaccine. I look forward to receiving this vaccine myself in the coming days as part of our efforts to demonstrate to Americans that these vaccines are safe and incredibly effective at preventing COVID-19. This first wave of Moderna shipments will be sent to more than 3,500 sites, a greater number than the Pfizer vaccine was sent to, in part because the Moderna vaccine can be accommodated in more sites, including harder to reach and more rural places. As we move forward, states will continue to adjust where they want these doses shipped to meet their needs. As many of you know, this past weekend, the Advisory Committee on Immunization Practices, sponsored by the CDC, made more recommendations about future waves of vaccine allocation. Those recommendations are there for states and other public health jurisdictions to use. We believe that these jurisdictions and their leaders are in the best position to understand their specific needs and allocate vaccines in these early days to save the most lives possible. As General Perna has said, that's the only goal here, save lives. I also want to remind everyone that OWS is not just about vaccines, but also therapeutics. And more Americans need to know about the 2 authorized antibody therapies that OWS supported in development and manufacturing. These 2 products help prevent hospitalizations in those patients with the highest risk for severe disease. We have allocated over 400,000 treatment courses to all states and territories, with 250,000 plus courses delivered, and many states have told us that they still have a lot of product available. If you have tested positive for COVID-19 and are at risk for severe disease based on your age, weight, or underlying health conditions, there may be a therapeutic option that could help you stay out of the hospital. Americans who may fall into these categories can find out more by speaking with their healthcare provider. Finally, I will reiterate what all of our public health leaders have been saying around the importance of mitigation measures as we go through the vaccine rollout. In the coming months, we have to keep up the good public health steps that we've been recommending for months, like washing our hands, watching our distance, and wearing face coverings when we can't watch our distance. This is especially important as we go through the holiday season. The vast majority of us remain vulnerable to the vaccine, to the virus, and we need to keep ourselves and our loved ones safe this holiday season. Thanks to the success of Operation Warp Speed, we've got such a bright future ahead of us. Let's all get there safely. With that, I'll hand things over to Dr. Slaoui for a scientific review. Dr. Slaoui?
Thank you, Mr. Secretary. Hi, everybody. Just briefly, first, of course, this past week, the approval of the Moderna vaccine by the FDA after, I think, a rich discussion and review by the VRBPAC. As you could see, I hope you had a chance to attend parts or if not all of those conversations. Efficacy and safety were frankly overwhelmingly positive. So was the vote, the positive vote. The only point of discussion that took place was in regard of what to do for the placebo recipients in the trial. Should they be kept on placebo? Should there be provided vaccine on the basis of priority populations as various risk populations are offered vaccine in the general population, or should they all be offered vaccine? And really what's at stake is how much more information can be extracted from a placebo-controlled part of the trial versus a non-placebo-controlled part of the trial. I'll be happy to address any questions you may have in that regard. There is also the start of a trial in adolescent population age 12 to 18 to enhance the label and expand the use in the population. And because of the great immunogenicity of that vaccine, there's also considerations on dose sparing trials in order to see whether a somewhat lower dose than 100 microgram that's being used could be as effective as the full dose. That's regarding Moderna. Regarding Pfizer, we have continuing conversation, very constructive, with the company in order to continue helping with their manufacturing requirements and in order to support their efforts to ensure that they would be able to provide us with an additional 100 million doses in the second quarter of 2021. And those discussions and negotiations are ongoing and progressing very well. On the Johnson & Johnson Janssen's vaccine, the trial has been closed for recruitment now with a little bit north of 43,000 subjects in the study. Really a remarkable speed of execution of that trial. A significant accretion of cases, unfortunately, in the study that's being conducted in Latin America and in the US. And we expect to have enough cases for at least an interim analysis early in January. We are working hard with Johnson & Johnson and with Emergent to ensure that we maximize or optimize the number of vaccine doses that would be produced, formulated, vialed, quality controlled, and released in the month of February. And that the numbers vary, and we're trying to optimize that number to enhance the number of individuals vaccinated with that one-shot vaccine. We're optimistic that it should progress quickly. AstraZeneca, the phase 3 trial that's being running in the US has now recruited north of 26,000 subjects, so getting close to the 30,000 mark, which is the objective of that trial. You know also that there are trials, phase 3 trials running in the UK and Brazil, and we are expecting a further analysis of those trials in the near future, hopefully shedding more light on the performance of that vaccine specifically. I'm sure you are all very attentive to the situation in the UK and the description of the particular variant virus. I had conversations this morning with my UK counterpart. I think scientifically, to date, there is no hard evidence that this virus is actually more transmissible. There is clear evidence that there is more of it in the population, and whether it's due to a higher capacity to transmit or whether it's due to the fact that we now are able to sequence all the time and see the virus, while when it was seeding the population in the southeast of the UK, we were not, or they were not looking for this particular variant. So it may be just seeding happened in the shadows, and we're seeing now a surge, or maybe it has a higher transmissibility. What's clear, it's not more pathogenic. And what's also ongoing is studies both in the UK and here at the NIH, where we're trying to isolate a virus that's a particular setup that allows for rapid neutralization of the virus, to assess that indeed serum and antibodies raised by the vaccines are able to neutralize this virus, which is very likely the expected outcome, and also whether some of the monoclonal antibodies that Mr. Secretary just spoke about as two approved medicines here in the US are still effective against this variant. Finally, also at the NIH, there is now advanced planning for a study in highly allergic individuals for a clinical trial to test the Moderna and the Pfizer vaccine and try to understand the immune mechanisms that are underpinning any reactions, if such reactions happen in the population, in order to improve our capacity to predict and manage any reactions if they were to happen. Broadly, that's the update. Thank you very much, and I'll pass on to my co-leader, General Perna.
Dr. Slaoui, thanks, and Mr. Secretary, thank you as always. So, team, last week we had a strong week, finishing the distribution of 2.9 million out of Pfizer, and this week we're heading into a big week at 7.9 million total Moderna and Pfizer vaccines being distributed. As the Secretary highlighted, For Moderna, the 5.9 million that's going out to over 3,400 locations, and then the additional 2.1 million for Pfizer going out to another 1,000 locations. So over 4,000 locations will be receiving vaccines between today and tomorrow. And then we continue to order on a repetitive basis. So I see vaccines being delivered again on Thursday, Wednesday and Thursday. And if needed, and if required, and if asked for by the states, industry is ready to go in delivery on Christmas Day, really to lean forward and make sure that everybody has access to the vaccine accordingly. We will begin to work a cadence, which I'll talk about in a minute with you, to illuminate the consistent delivery of vaccines on a repetitive basis to allow everybody to understand the confidence that vaccines will come when ordered. Before I do that, though, I'm never going to miss an opportunity to say thanks to industry for the Herculean work that they're doing. This weekend, when most of America does try to take a couple days off after, a long week working, doing all their due diligence and working in and around COVID, these industry partners worked all weekend to make sure that vaccines are properly stored, they're properly packed, they're properly labeled, and that they're moved into distribution places so that we can deliver on a regular basis, Monday through Friday, as orders occur. So, hats off to Pfizer, Moderna, McKesson, UPS, and FedEx. Really just a remarkable job for all of them. We do still feel strongly that we will have allocated to the states by the end of the year 20 million doses of vaccine that'll be available. I'll allocate it, and then the states will order the vaccine as they need for their locations by numbers. And we feel confident that that will be distributing the end part of that vaccine no later than the first week in January for everybody to have access to. The cadence that we've instituted now that the first push from Pfizer went out and the first push from Moderna going out today is what we want is a regular cadence of distribution. Allocations will go out every Tuesday. On Thursday, they will be, for microplanning to the state level, on Thursday, they will be unlocked and releasable for ordering. And so anything ordered following the release will be delivered on Monday, Tuesday, Wednesday, Thursday, Friday of the next week. Really allows the states and the governors to execute their plans in a good, rhythmic, consistent basis to ensure that we get the right vaccine quantities to the right places so that it is most effectively used inside of the governor's strategies and plans. Really, really important aspect of our delivery process. So we continue to learn every day. We're getting better at what we are doing. Industry and OWS, CDC collaboration is very high. We talk several times a day, and we conclude with lessons learned as we go forward. Things like, exact addresses for labeling, very important for final deliveries. How to schedule, how to coordinate and schedule where they want deliveries to be. So not only is the vaccine been ordered, picked to that quantity, distributed in the time that they want, but everybody's ready to receive the vaccine so that it can be immediately accounted for and then begin shots as we've seen. Really miraculous effort. But we want to make sure, from the strategic to the operational to the tactical level, everybody is synced and nested. And we get stronger on that every day. The big lesson learned is we want to make sure that the states have good timing. They have great plans. They've worked hard on their plans. But now, as we allocate on a Tuesday, they really get to finalize their micro plans on Wednesday and Thursday, and then we release the doses to where they want to be. Really, really been effective as we work through this the last week. And then the last thing is the continued open communications at all level is just essential as we want to make sure we're doing the right, getting better every day, It's key to our success. And so I applaud the states and their teams for being alert and collaborating with us. I applaud the CDC for their effort in continually getting word out to everybody as we go through it. And then our ability to adapt to those lessons is just going to be crucial. You know, we're by the end of next week, we'll be 11 million doses distributed to the American people, but we have a long way to go. And we want to be better and better and better every day, every week, every month to ensure the right vaccine gets to the right place at the right time.